Welcome to the 2019 World Medical Innovation Forum. I'm Chris Coburn, Partners Chief Innovation Officer. I'll be timekeeper, transition point between speakers, and will remind you to use the app to participate in the podium dialogue during the next 3 days. You are also encouraged to push out your comments on social media, and many thanks to those of you who've been active already today. It looks like we have a nice story brewing out there in the Ethernet. And also, we want to encourage you to give us your feedback, what was most valuable to you about the forum, and what we could have done better. So, important topics for us. And additionally, this year we'll be using an artist to visually capture the content of each session and share it on the screen, and then ultimately through social media. And soon, starting with the first panel, you'll be able to see Allison from the Ink Factory work. You'll see her work on the big screen later in the afternoon. We start this forum, though, by thanking each of you. We have broken all records with 1,796 registrants so far, and I saw people in line there earlier, from 30 countries and nearly 600 organizations. It's wonderful to see so many friends in the audience, including the people who are standing in the back row there. There are seats over here if you're looking for a comfortable place. But before I go on with the introduction, let's take the opportunity now to make a new connection. I want to ask everyone to say hello to the person sitting next to them. Take a moment to do that. Okay, mission accomplished. We are deeply grateful to our remarkable sponsors, some of the most important organizations in all of healthcare. Bayer, our presenting sponsor, has been a terrific partner and has sent a large delegation of senior team members, a number of them traveling from Germany. Please personally thank and engage them over the course of the forum. Our stakeholder sponsors collaborate with us in a multitude of innovative ways. Heartfelt thanks to Bristol Myers Squibb, GE Healthcare, Nuance Communications, and NVIDIA, each reshaping healthcare. Our strategic sponsors have added much to this year's forum. A grateful shout out to Amgen, Biogen, Siemens Healthineers, and Wolters Kluwer. Many thanks to our collaborating sponsors, Boston Scientific, Canon, the Center for Clinical Data Sciences, Fujifilm, Mintz, Northern Light, Persistent, Pure Storage, and Red Hill, as well as our media sponsors, Health IT Analytics, and WGBH. We recognize and thank our 188 speakers, international CEOs, Harvard faculty, top investors, leading entrepreneurs, principals and patients from throughout the global healthcare community. Finally, I have the great pleasure of introducing the next speaker, as I have had at each of the World Forums we've held during the past 5 years. At a global gathering like this, we celebrate a lot of firsts. Anne's many path-breaking accomplishments and her leadership in each phase of academic healthcare as a gifted clinician, brilliant scientist, compassionate patient caregiver, and skilled executive are widely recognized, as is her terrific sense of humor. Her enterprise-wide, hands-on leadership of Partners' game-changing digital and AI strategy as a recent example of how she has substantially improved our organization. She's a prized mentor, boss, and colleague with the enduring admiration of all who work with her. Today, following action by the Partners Board of Directors in February, it is my distinct honor to introduce her as Interim Chief Executive Officer of Partners Healthcare. Please join me in warmly welcoming Dr. Ann Klibanski.
Thanks very much, Chris. It's a great pleasure to be here. So first of all, good afternoon, and thank you for joining us. I will add my thanks as well to this annual World Medical Innovation Forum on behalf of Partners Healthcare, and I welcome you all to Boston. We've been preparing for your arrival. We welcome you, and I really hope that you will find this as exciting an event as I think it is. So, I think at Partners, it's fair to say that we are very proud of our work that we do in patient care, in research, and in teaching, and what we provide to the community where our patients live and where they work, and also to the national and the global community. The question I always ask, and I ask this of all of us, is why are we here? And I think it's important to just take a minute to reflect on why are we here. And I would say we come together because of what is really a collective vision for the power of innovation, and specifically AI, to improve the health and the lives of our patients everywhere. And if we can keep that in mind and keep the patient at the focus, at the center of what we do, I think we will be better off. And I think what we will see in the next few days, and we're already seeing, will tell us that is the direction we want to go. And so specifically, we have a commitment, and that commitment is in understanding and also intelligently implementing how artificial intelligence will transform patient care on a real, on an imagined, on a future basis. We have very, very profound changes going on right now in academic medicine and in medicine at large. We have new disease-curing therapies. We have a new sense of what meaningful patient engagement is. We have incredible downward pressures on reimbursement, on increased risk, and rapid advances that are going on everywhere, as well as what are the real promises and also the real fears of what big data has, and they're all occurring simultaneously. I would say here at Partners Healthcare, with its 74,000 employees, its over 3,500 Harvard faculty, and its $1.8 billion in annual research expenditures, we have long invested in large-scale data aggregation, data curation, and in thinking about algorithms that will foster novel research and, of course, novel patient care. Now, our hospitals have already invested in this. We've invested, as you've heard, in the MGH Brigham and Women's Center for Clinical Data Science, which is really a hub for AI with major collaborations with companies worldwide, some of whom you've already heard about and heard from. We've recently developed and are investing in a very broad, multi-year digital health initiative. All that can't be done alone. That has to be done in collaboration. That has to be done in partnerships with clinicians, with healthcare systems, with companies, nationally and throughout the globe. And I'd like you all to keep that at the center of all of what you hear about and think about over the next 2 days. So this year's event, where AI meets clinical care, brings together global leaders from all sectors for these kind of conversations. These conversations really should be stimulating collaboration and innovation, and if they don't, I think we haven't succeeded in bringing the best of what this forum has to offer forward. You've already heard our gratitude to the more than 180 senior executives, investors, clinicians, investigators who speak at the forum. And that, of course, is the unique aspect here. It's bringing together these sectors to think collectively about this and then to implement based on those conversations. I think, like many of us, we've all been in many conversations, and the challenge we all have is how many of those conversations actually lead to the kinds of things that we can and are able to accomplish. I want to also offer my thanks to Chris Coburn, Partners Chief Innovation Officer, for his continued commitment to this forum. Chris and his team worked tirelessly all through the year at really trying to convene the interesting and insightful speakers you want to hear about, you want to spend time with, and you want to get to know. I also have a word of thanks to my co-chair, Greg Meyer, Partners Chief Clinical Officer, my comrade in arms, and a valuable member of the continued success of our forum and its team. So our goal, again, is to create an exchange that will guide the structure and implementation of AI into clinical care. And some of these things and the challenges are the things that are going to occur in the next 6 months. And some of these things will occur in a year and some in many years. And I think it is the responsibility and the challenge to all of us to think, what is it that we can do in the near-term future, and what are those investments, and what are the things we ought to be thinking about collectively a little bit further and into the future. So again, I welcome all of you, and to have the pleasure of kicking this off, it is now my great honor to introduce the moderator of our first panel, Dr. Susan Hockfield. Susan is professor of neuroscience, also president emerita at MIT, and the title of her panel is AI Strategy, AI from the Top. And we welcome Susan and her panel, Dr. Hockfield. Thank you.